Really important that all Ohioans know this is unusual. From the very beginning, when we took the steps that we've taken, closing down borders, the kinds of actions that you are seeing in public health, we've known all along that this is our best attempt to slow down the spread of disease, and it matters that we do that. And that's why here in Ohio, we will be taking very aggressive actions. We are leaning in, we've been leaning in all along, and we will be providing guidance to Ohioans in the days to come. If you look at a place like Italy, 2 weeks ago, they had 9 cases. And so we see how quickly, hour by hour, things can change. 95% of the cases they have now happened in the last 10 days. And so as this situation evolves, it's becoming increasingly clear that there is community spread. We're watching, I'm working with my colleagues in each state. We're talking every day. I'm talking to the federal government, to the White House. The governor just had a call for all governors. We're getting the latest information, but we as a state in Ohio are leaning in and taking aggressive approach. I want to tell you a little bit about who is most at risk for this disease. There has been some studies released just this weekend from the World Health Organization. If you remember, they went into China to study this more along with some CDC colleagues. There's also been a little bit of science around South Korea. And so increasingly we're knowing that the older you get, the more at risk you are. Younger people seem to be even less at risk than the flu. But we know that our seniors are most at risk, and those are the groups we're reaching out to now. So people who are hospitalized, people who are elderly, also at risk are people with chronic diseases, so people with heart disease, lung disease, people who are severely overweight, people who are immunocompromised because they're taking maybe drugs for a cancer. These are the folks that we, in particular, are speeding up the testing on and prioritizing because we know they're most at risk. Our healthcare workers are also at risk, and we're taking unprecedented measures to protect their safety through our partnerships with hospitals, with nursing homes, with long-term care agencies. So we will continue to protect them. For most of us, I want you to continue to come for your guidance because, as I've said all along, the situation changes hourly. And so it is coronavirus.ohio.gov, tips for everyone in the general public, but also for businesses, schools, nursing homes, daycares, preschools, for all sectors of society. And as the governor said, our hotline is open right now. It is 833-4-ASK-ODH. Again, we've learned from history and we've studied pandemics, and I do call this a pandemic because in my mind, it definitely meets the criteria of that when we see this sort of community spread. The actions we take today and in the days to come here in Ohio will make our lives a little more uncomfortable. You'll be hearing guidance on travel, on visiting your loved ones. We don't want you visiting your loved ones in a nursing home if you're sick. If you live with someone who's in one of these high-risk groups, you should treat yourself in a household as a vulnerable household. Don't just think about the one person. One of the things Dr. Fauci just said to me on a phone call was, when you are in a household with someone who is at risk, treat yourself as if you have the disease and take the same precautions. And that's how we can protect our most vulnerable. So much more guidance will be coming, but people do need to know that it won't be life as normal in this country for a while. And we will be leaning in and asking businesses and everyone to cooperate as we give guidelines for what's best for Ohioans. And again, we will come to you with everything as we know it, the second we know it. Thank you.
We can take some questions.
Are the persons who've been in contact with 3 people who have been diagnosed, are they being quarantined, and how many people are we talking?
We are talking about 3 individuals, and we'll have demographic data on that very shortly for you, as soon as they know. But in the first part of your...
Let me...
Yes. The second they were expected or suspected of having a need to be tested, the local health department was working immediately with them, letting their contacts know. But I can tell you that investigation continues because our turnaround is so rapid now. We received and immediately ran the specimens. So that local health department will be reaching out soon to explain more once the patients are notified, and they will tell you about the investigation and the details.
Amy, you might tell them and explain again the basic procedure once
Yes.
someone is identified, because I think that's
Yeah.
important so they understand that people who that person came in contact with then will be contacted. So if you could kind of go
Yes.
through that.
So when someone is even suspected, they're put in quarantine. And if they're ill, they're isolated. Remember, ill is isolated. Beginning right away, the health department is already doing a very extensive evaluation of everywhere they were, where they traveled, anything that is known about them, and anyone who's been in contact with them. It's an elaborate investigative process. It's already underway. And if anyone came into contact with the individuals, they will be notified. So please know that you will be notified if you came into contact with the cases.
Amy, let's give this a minute.
Please.
The 3 Ohioans have now been notified. All 3 are from Cuyahoga County. All 3 individuals are in their 50s. One couple was on a cruise on the Nile. One of them has been hospitalized, one not. The third person, unrelated, the first 2, went to APAC conference in Washington, D.C. So those are the essential facts that we have at this point. John, you want to say?
No, go ahead.
Governor, do you plan on canceling any of the NCAA tournament games or not canceling the games, canceling attendance?
All things are certainly open, and again, we're going to be advised by our advisory doctors about those things. So we don't have any announcement today, but again, as this moves forward and as this situation is analyzed, you're going to be getting announcements from us every single day. And again, we have to be cautious. This will change people's lives for a while, and the whole goal is to make sure Ohioans are safe, and so we have to focus on that at this point.
Can you define what a state of emergency means?
Well, I think let me just be quite candid. I would not read too much into the state of emergency. It enables us to do a few things in government that we couldn't have done. It makes it easier for us to procure medical supplies, for example, and not have to go through the normal state bidding process. I wouldn't read too much into that. I think, listening to what Dr. Acton said is probably more important than hyping the state of emergency. It is a legal necessity that we have to go through if we are going to be able to get these products quickly.
Governor, the couple in Cuyahoga County, was that a man or woman?
Yes?
Married couple?
Couple is the way it was described to me, so I don't know that. One would assume it's married.
Married couple in their mid-50s.
Yeah.
As is the third unrelated individual is in their mid-50s.
So again, just notified. The process now, it begins to try to, talk with them, get information from them about who they've had contact with, and that is what the health professionals call an investigation. Now, obviously, it's different than what I'm used to as a prosecutor, but it's an investigation to find the facts and then to be able to, notify as many people as possible who they may have been in contact with.
And so that third person is unrelated to the...
Yeah, totally unrelated to the first 2.
But
You
also
said they
in
were
contact.
at
APAC conference in Washington, D.C.
So we have the cruise couple.
Yeah, 1, 2, that's correct.
Information available at the website.
Yeah, you want to give them that. Anything else?
The Democrats in the legislature sent you a letter asking for you to set some funds aside for like low-wage workers who, collect funds and stuff, and could potentially spread the disease, they don't have paid sick pay. What's your view on that?
I don't have a view because I haven't seen it. I just was shown that there was that letter. But look, we're open to all kinds of suggestions. We're not ruling anything out. We'll look at them and try to make decisions, and we'll make decisions in real time as we go forward. I mean, what happened today, we knew was coming. Every health expert told us that we were going to see this. It was just a question of time. Most health experts said there are people out there who are positive at this point. They just have not been tested. So what you're now seeing is, as the state has now the ability to kick in, and again, the reason we didn't have the ability before now is we didn't have the reagents from the federal government. So once we got those on Friday, we started moving forward. Testing has started, and so it would not surprise anyone, I'm sure, if we'll continue to see people who test positive. But this is now kicked in at a much higher rate. I don't know, Amy, whether you can give numbers on how many tests have been run. It's a moving target. So.
Yeah, unfortunately, I haven't been briefed by my team, but I know they posted numbers at 2 o'clock, and I suspect there'll be some updates to that because we learned after the numbers were posted, so stay tuned.
Anybody else?
Dr. Gack, can you describe a little bit about the aggressive measures you're going to take to protect healthcare workers? Just a little more.
Yes, I'll give you much more in time to come, but we've been working with all the hospital systems all along. Of course, they prepare for this all the time. They have infectious disease protocols, and they've been running the traps for weeks, working with their staffs. They're doing things at hospitals like instead of the whole group of, the residents and the whole tribe coming in your room, they're down to 1 to 2 people, and there's a whole list of measures. I know OSU, for instance, just released their protocol today. They're training all their staff in how to use PPE. They're looking into the PPE as a protective gear that healthcare professionals wear. We do know there are shortages, so they're making all sorts of contingency plans for that. So our healthcare systems have been working all along. Similarly, in nursing homes, schools, even in businesses, everyone is going through their plans. They prepare for things like this, and they're going to the next steps of it. And I think that's what you'll see all around the country, everyone going to the next step in their plan.
Dr. Ackman, you mentioned a couple
Yes.
were on a cruise on the Nile.
Yes.
Do you know if there's discussion going on with this cruise line right now? Is their attention much bigger problem?
I believe that has already been going on. I believe that cruise was already known.
Is that how we learn about these people, or did they become ill after they returned?
They returned home and became ill, but then shared with their healthcare provider their travel history. Again, we're working very closely with healthcare providers on how to take those good histories and know who is at risk, and that's exactly what was executed here. Great. Everything was handled exactly by the book. They suspected these folks. They immediately, isolated them because they were sick. One, in fact, is hospitalized. One is the other spouse is not.
Can you tell us the condition of the person who's hospitalized?
I cannot at this time.
Because you don't know, or because?
Yeah, I'm not aware.
Governor, you talked about stopping non-essential travel. Can you explain to people at home exactly what that means so that there's no confusion?
Well, it means that if there's any travel done by a state employee on state business, they better have a real good reason for doing it. Again, some travel may be necessary, and look, if a person gets in a car and they travel and they meet just several people, that's one thing. The risk is much smaller. If someone goes to a conference, well, they're not going to any conferences. We're not sending anybody to go to a conference. That's all canceled. So, I think if you I can dream up a scenario. If you have a murder investigation and you have some vital evidence, well, that vital evidence needs to go to the lab so we can find who the murderer is. So that would be one extreme, and that would need to take place. But again, this is all about contact with people. It's about minimizing that contact. It's about not taking unnecessary risk. As we talked about on Saturday, life is full of risk, but we take precautions in our life every day. Well, what's happened is the game has changed on us, and so we've got a bigger risk out there than we've had in the past, and we have to, treat that appropriately, and we need to treat this disease, this problem, with a lot of respect.
So here or Dr. Atkins, we know the gender of the third person, but you said that, I apologize.
It's a male.
So,
Thank you.
so it's a male, female, married couple, one of them is hospitalized.
That's correct.
And sorry, did you say which one were you?
I don't know.
We do not know.
Okay.
I don't know.
The other person is also a male.
That's correct. That's correct.
Governor, to clarify, I mean, you were referring to the American Israel Public Affairs Committee, or other people have been found to have contracted?
That's correct. That's correct. That's correct.
That's correct.
Oh, I'm sorry, did I say,
Well, in New York.
yes, that's correct, yes. And that was my mistake. I said Washington, did not mean, that was a
No,
mistake.
I'm sorry, it is DC. My
It is.
bad.
Is it DC?
My bad.
Okay.
It's DC.
I trusted you so much, I figured.
And you're
you were
right, you're right. The conference is already known.
Fact check me, Governor.
Yeah.
But the conference already has been identified as a,
Yeah.
Governor, there are 2 presidential rallies expected to take place in Cleveland tomorrow. Are you advising?
look, you know, I'm the last person to, in any way, advise another politician what to do, but I would simply say that a gathering of a lot of people is probably not a great idea. They have the right to do it. It's the First Amendment. We're not going to block people from doing that. But I think, you know, certainly if you're elderly, if you have any of the things that Dr. Acton talked about, I wouldn't be going. And I think if it, you know, if these are, again, I'm not trying to dampen crowds down in any way, but I think I would think long and hard about it. Doctor?
You know, I think this situation is evolving hourly, and I suspect that many, many people, as we watch what's happening in the United States today, are rethinking a lot of decisions. So I suspect much will happen voluntarily as time goes on. For these high-risk groups, you want to avoid crowds. You do. For normal, healthy folks, if you're in and out of a place and you're still washing your hands, taking all the precautions we've been talking about all along, you can still do that. But I think what we're seeing here, guys, it's imperfect because we've not been through this. This is a once in a 50-year situation, and we're seeing sort of the psyche of the whole country wake up to this and adjust moment by moment. And I think it's going to be like this, very inexact, and I think we'll see much more of this.
And I think one thing Dr. Atkins said is very important, at least as she has explained it to me. Remember, I'm the guy that got D in science, so I'm not. But if you live in a house with someone who is elderly, you need to be extra careful.
Yeah.
Doctor, are you testifying or testing for any suspected cases of community spread?
Yes, Randy. When we did our press conference this weekend, we talked about taking a 3-pronged approach. We have to know that there's a limited supply of testing. Those resources are growing by the day. We're already in the queue to get more reagent, but when we received our first shipment, it was for about 300 to 400 people testing. We're doing well with that now because, you know, we're just beginning. We're taking the highest risk folks. The private labs are taking some of the more low-risk outpatient folks, but we had a 3rd prong to our strategy in Ohio. We're doing some sentinel surveillance, which means we're looking for clusters, and we do that based on our influenza-like illness federal program that surveys for things, and if we see something, a good example would be if we saw in a nursing home where there are a lot of folks with respiratory illness and they were testing negative for flu, to me that would be suspicious, and we would do some look at that as well. So we're looking as rapidly as we can at community spread, and we're assuming, you know, it's here in some form.
How does that work? Is it?
Let's go over here first.
55, or is it, I mean, are these people elderly in your definition? What's elderly?
So, being 54, but I mean, he thinks I'm young one. So you know, what the initial data is seeing, and if you look at a World Health Organization study that just came out, I have the graphs but not on me, literally you can watch it climb up the age ladder. So the flu, we've often said that the rate of our mortality is being around somewhere around 0.1. We said that this disease, people are saying between 1% and 3%. We know that SARS was worse, MERS worse yet, and so we have this sort of scale. We have to realize this. If you are 40 to 50 years old, and in flu is 0.1, the numbers in some of these preliminary studies are 0.4. And folks are starting to do the math on this. And they're saying that means that middle-aged people are at a much higher risk than they are for the flu. And I think you'll be hearing some of these numbers come out shortly. And so that's very, very important. I'm going to explain something. It's a little bit complicated, but the data on these countries like Italy, even South Korea, are lagging because by the time a case is diagnosed, it's going to be sometimes on average 9 to 12 days before that person is hospitalized if someone turns for the worse. Deaths from this disease are being delayed by 3 to 6 weeks. So we just don't know enough yet. But we know that it is increasingly risky the older you get, and if you are already having health conditions. And again, we're talking about a respiratory disease. And for people at home, again, most people still will do well. They'll ride this out. But for some of the high-risk groups, you should contact your doctor sooner than later, even earlier in the illness if you're in the high-risk group. If you're elderly, if you're in this group of high-risk people, or if you're a healthcare worker that has been in contact with someone suspected or known, or someone with that travel history, you should talk to your doctor sooner than later in your symptoms.
Governor, the president often does a rally or a swing through a state just before a primary. Have you asked him not to come to Ohio before the 7th?
No, I have not. I've not asked the president not to come to Ohio. We just got this news, and no, look, I think you have to be very careful when we're talking about the First Amendment and people's rights to do things, and that's what I said about the two Democrat candidates who apparently are having a rally. Look, we can't tell people not to go to that. We can't tell them not to. We shouldn't tell them not to have it. I'm just saying that certain people at high risk, you probably need to be very careful about that.
And I will say, and that's just true for all events. So this isn't about a political, this is using common sense as citizens and as we learn more. And again, we have such good information for you. I can tell you that it's very, very important that we vote, and we're working closely, the governor's task force and his team are working closely with the Secretary of State. I know the Secretary of State will be speaking to this tomorrow. We want to make sure it's healthy for people to vote, and they're taking, I'll let him explain that more to you, but we're giving great advice to the Secretary of State on how to do this and do this well so people can vote. And you can still vote. There still is early voting. VoteOhio.gov is the Secretary of State's website, so you can learn more about this. But it's very important we all vote, and you'll be hearing more about that.
I can add something to this a little bit. Finally, something I'm qualified to discuss, right? You can still vote by mail. Voting by mail is an option that I would encourage everybody to take advantage of. There is time to still do that. Don't worry about your vote not being counted, as so long as it's postmarked by Election Day, your vote will be counted, and there's still time to do that. So I would highly encourage people who are in those vulnerable populations, and for the sake of the integrity of the system, that you might want to consider voting by mail.
Okay, we will be back when we know more things. Amy, anything else?
My only thing would be to be good to each other. There are a lot of people who are scared, there's a lot of fear, and there's a lot we can do to help each other. So we're going to do this together in Ohio.
Thank you all very much.